I'm Philip Ward, Editor-in-Chief of AuntMinnieEurope.com. The opening day, the Wednesday of ECR, is Breast Care Day. So to mark this, we're looking forward to a session tomorrow about the future of mammography. I'm very pleased to have with me Dr. Giannotti from Nottingham. Welcome, Betty, to ECR.
Hello, hi. Thank you to invite me for
Good.
this interview.
Excellent. Now, you're talking tomorrow about the future, about your predictions for the next 10 years of mammography. Could you just explain a little about what you're going to say to the session tomorrow?
Absolutely. So the title is My Prediction, but unfortunately I don't have a crystal ball, so I could not give prediction, but I hope that within the talk we can go through some hypotheses. And I think this is really important to talk about hypotheses, because nowadays we should move possibly to a different culture, to a culture of uncertainty, and be open and honest with patients as well about uncertainty and tolerate this as well. So talk about hypotheses.
Okay, excellent. Now the techniques I think that people are very excited about: contrast mammography, tomosynthesis, and also 3D in mammography. Which are you most excited about yourself? Which do you think are the ones that show most clinical promise?
Yeah, personally, I think that contrast mammography is really, really promising, because combine the morphological analysis of the breast with a functional analysis of the breast as well, because we use iodinate contrast. So we enhance the area that uptake contrast as like tumor with neoangiogenesis. And the introduction of this technique in the diagnostic setting showed that the performance is very good and is comparable to MRI. Is really fast, easy to perform, the patient really well tolerate, and it's really fast to read as well. Of course, we use the iodinate contrast, but I think that is a really, really promising technique. We use in our clinical practice, and actually really happy with that.
Good. Now I have to ask you a related point, the combination with molecular imaging with mammography. Could you tell us a little bit about your thoughts and your philosophy on this?
Yeah, I think that in the future we will need to ask help to AI, artificial intelligence, and we can basically mine and collect all information from our standard techniques, so like mammography, contrast mammography, tomosynthesis, MRI, ultrasound, but also like metabolic information from molecular imaging, optical imaging, and giving all this information to AI and a gold standard. So collecting data, giving them a gold standard, giving them information about the patient, the outcome of the patient, that can develop an algorithm, and we can use this algorithm for the future, so to like stratify the risk of our patient and possibly characterize the lesion as well. Okay,
so how about the switch from 2D to 3D? Do you think a radiologist now, breast radiologists, should abandon 2D systems and look towards 3D?
I don't think so. I think 3D is great. Tomosynthesis is very good, show high sensitivity and specificity, let us find more cancer. But actually in screening we must remain sustainable and must be feasible as well, and our resources are limited, so we cannot offer everything to everyone. And I think that will be some women that just will need like standard mammography, and there are others that have an higher risk that will need like tomosynthesis. So what we need to do, I think we need to use our image, like mammography as well, to do image-driven risk assessment, and with that personalize the screening.
Okay. How about the switch from analog to digital? Is this something that is very close, that is on the horizon?
Yeah, so I work in UK. In UK we pass digital, and I think it's fundamental to pass digital, because without the digital we cannot implement the new technique as tomosynthesis and contrast mammography. So we know that digital let us diagnose more lesion as calcification, we can do post-processing, we can, and in terms of save picture as well. So I think it's something we need to move.
Okay, so the discussion tomorrow will be about where we are in 10 years' time. Yeah. Could you look a little bit ahead? Or will it be fully digital? Will it be molecular? Will it all be 3D in 10 years' time?
So I hope that will be fully digital, and I do believe that in 10 years we need to move to one-size-fits-all of screening to a tailored breast screening. So because now basically outside the familiar setting to the general population, what we are offering is the same for all. But we need to stratify the risk, invest more resources in the women that are at high risk for breast cancer, and save money in the patients that have low risk or no risk at all. And also another thing that I do believe we should not only like personalize the screening, but also possibly move from a secondary prevention to a primary prevention. So like identify the patients that are high risk and that are suitable for preventive therapy, like with tamoxifen or aspirin, and also promoting lifestyle change. That is very important for breast
now,
cancer.
overall, would you say you're positive about the future of mammography?
Absolutely, I'm absolutely positive, because I think I started to be interested in breast imaging 10 years ago. We were not digital, there was not like tomosynthesis or conscious mammography in our clinical practice, and in 10 years a lot of things have changed. So I do believe that I'm really positive that things will go well.
Good. Betty, thank you very much for joining us. We wish you luck at your session.
Yeah.
I think it's in room C tomorrow morning, 8:30. We would urge everyone to go along and enjoy the rest of ECR. Thank you for being with us.
Thank you, Philip.
This is Philip Ward, Aunt Minnie Europe, signing off.